small dog handling and examination. Place up. This is a 7-pound Toy Fox Terrier Chihuahua something mix. And this is to show you that not all small dogs need to be snappy and non-handleable for their exams. So, what we do, we're going to start out a little bit of loving. So we can look at teeth. They'll let me look at his mouth. So we can look at his teeth, get a load of his canines, and same for the other side. Look at that, pull back, and look at those premolars. Ready to open? Yes, good. He knows that the open generally follows the exam settle. Open? Yes. Just because that's what the vet always does, so that's what we do at home. Follow up a look at the teeth with a look, just having him open the mouth. And let's look in the ears. Those are beautiful ears. And then you can clean them. Maybe do a little wet willy there. Look at that. That's your ear. Yes, it's clean. Nothing in there. So then we'll kind of give him a little touch all over, and he's used to this. He just knows, yeah, whatever, this again. But this is what you should be able to do to any dog. 120-pound Rottweiler, 7-pound Chihuahua mix. So he'll stand up. We can do toes. We just Dremel back those toes. You try and put a clipper to those, you're going to amputate the toenail or the foot. But we can do feet. We'll press each toe. Take a look at those. Do the back feet too. Take a look and another look. And he is pretty wound today, so this is actually an exercise in having him just kind of stand and be calm. But if we need to, we can feel in between the pads. Heaven forbid we get something up in there that we need to take a look at. Another one. And again, say, place up now. You are wound. Take a look. There we go. So then we can touch him all over. Little shoulder blades, right down the spine, abdomen. Feel his pulses, just like at the vet. Yeah, I know, just like at the vet. And touch all the way down his legs. Heck, while we're here, let's hold off a vein. And we'll do it with the other leg too. We'll hold off a vein. And then since we're doing it, let's just go up front, hold off that vein. Good. And hold off that vein too. Just not poking him today, just so that he knows the pressure, knows what that feels like. And then he is not the biggest fan of having his tail touched, but it's going to happen, and nothing bad's going to happen. So, there. Touch his tail again, lift it up. Vet's always going to check anal tone and the dreaded thermometer. So there we go, good boy. And that just shows you small dogs can be handled. Let's look at his coat, get a look at his skin, look at his undercoat, because the vet always wants to look at the skin too, make sure there's no lesions, there's no infection, no fleas. So we'll take a good look at that. And then we're just going to do a little brush, because I can. Because he's pretty low maintenance, and even if he were a long-haired dog, he would have to let me do this, and it would be done regularly. There's no matting, it's not painful to him. So that's a big plus. So we'll go down the leg, go to the other side. So, good. There. Not the biggest fan of his tail, but he knows he's not going to die. So we'll do that. And when we're done, release. Good boy. Leave it. Just shake it off, and then we're ready to do it all again. There you go. Good boy. It's not all the snappy snappiness of your typical small dog. Just takes handling and training. You need to do a little tracheal things there. We can feel that all the way down to his chest. Kind of moosh him all over, love on him. Good boy. Handling and training, release. Good boy.